Atropine sulfate ointment is used before eye examinations and to treat certain eye conditions such as uveitis. It belongs to a class of drugs known as anticholinergics. Atropine works by widening the pupil of the eye. It is important to use this medication as directed by your doctor. The usual dosage is a small amount of ointment applied to the affected eyes 1 to 3 times a day. This medication is typically used before eye examinations, and it is best to apply it at least 1 hour before the appointment. When using atropine sulfate ointment, start by washing your hands. Be careful not to touch the tip of the tube or let it touch your eye to prevent contamination. Tilt your head back and gently pull down your lower eyelid to create a small pouch. Then, apply a 1/4 inch strip of ointment into the pouch and gently close your eye, rolling the eyeball to spread the medication. Avoid blinking and rubbing your eye. If you are using this medication on a regular schedule, apply it as directed by your doctor, usually 3 times daily. Do not use the ointment if it has changed color. Wipe the tip of the ointment tube with a clean tissue before recapping it. If you are using other eye medications, wait at least 5 to 10 minutes before applying atropine sulfate ointment. Also, remember to use eye drops before eye ointments to allow the drops to enter the eye. To get the most benefit from this medication, use it at the same times each day and do not miss any doses. Continue using it for the full time prescribed. If your condition does not improve or worsens, inform your doctor. When using atropine sulfate ointment, you may experience burning, stinging, redness, eye irritation, or temporary blurred vision. If these effects persist or worsen, consult your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, if you experience dizziness, fainting, increased eye pressure, slow/shallow breathing, mental/mood changes, or fast/irregular heartbeat, it's important to contact your doctor immediately. While serious allergic reactions to this product are rare, seek medical help right away if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to consult your doctor or pharmacist if you notice any other effects not listed above. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using atropine, make sure to inform your doctor or pharmacist about any allergies you may have, especially to belladonna alkaloids. It's also important to discuss your medical history, especially if you have a history of glaucoma, Down syndrome, brain damage, or spastic paralysis. After applying this ointment, you may experience temporary blurred vision, so it's best to avoid activities that require clear vision, like driving or using machinery, until your vision clears up. This medication can also make your eyes more sensitive to light, so be sure to protect your eyes in bright light and wear dark sunglasses when outdoors. If you're using this ointment on infants or small children, be aware that they may be more sensitive to the side effects, and be sure to keep the medication out of their mouths. And always remember to wash your hands after each use. If you're pregnant, only use this medication if it's clearly needed, and discuss the risks and benefits with your doctor. If you're breastfeeding, consult your doctor before using this ointment. When using atropine sulfate ointment, it's important to be aware of potential drug interactions that could affect how it works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not make any changes to your medication dosage without their approval. Always consult with your healthcare provider before making any adjustments to your medication routine. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911. Otherwise, contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include flushed or dry skin, blurred vision, fast or irregular heartbeat, fever, changes in mental state or mood, and loss of coordination. This medication should not be shared with anyone else. If you happen to miss a dose of atropine sulfate ointment while using it regularly, simply apply it as soon as you remember. However, if it's already close to the time for your next dose, it's best to just skip the missed one. Avoid doubling up on doses to make up for the missed one. Stick to the regular schedule for your next dose. It's important to store atropine sulfate ointment at room temperature and away from light. Make sure to keep it out of the reach of children and pets. When it's expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal instructions. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.